Good afternoon. We're going to get started. We are one short of a quorum. I'll announce when a quorum is present. Welcome to the Minnesota Senate Commerce and Consumer Protection Committee. Today is Tuesday, April 11. Time is 2:10 p.m. We will begin with Senate File 49, Senator Wiklund. Welcome to the committee, Senator Wiklund. Senate File 49 is in front of us. Please proceed.
Thank you. Thank you, Mr. Chair. Thank you to the committee for hearing Senate File 49 today. Senate File 49 includes several provisions that work together to help more Minnesotans get access to the affordable and reliable health care that they need. We know the current health care system is not working for everyone. Too many people are being left behind, unable to access or afford needed care for themselves and their loved ones. Through a mix of immediate and longer-term solutions, this proposal lays out a comprehensive and thoughtful plan that supports the health and well-being of all Minnesotans. The goals of this healthcare package include breaking down the barriers that prevent Minnesotans from accessing and keeping the coverage they are already eligible for. Also, providing relief for working Minnesotans who are struggling with high out-of-pocket costs. It sets in motion transformational changes that address the high and growing costs of health care and provide Minnesotans with more choices for affordable coverage. It keeps Minnesota at the forefront of innovation, and most importantly, it puts people first. From ending burdensome administrative hurdles in our medical assistance program for families with young children, to giving children the same access to care no matter their immigration status, this bill creates the opportunity for all children and youth in Minnesota to grow up healthy and strong. And because far too many Minnesotans still can't visit their doctor despite having health insurance, the proposal includes assistance targeted towards those who struggle the most to meet their outrageous deductibles and copays, ensuring that they don't have to wait for an emergency to get health care. Finally, several of the proposals I will included establish a framework for transformational change. We are building out a more affordable option for Minnesotans to get comprehensive health care coverage by allowing Minnesotans to buy into the state's Minnesota Care program. And we are investing in meaningful data collection and analysis that will give policymakers the tools to finally get at the systemic changes our healthcare system requires to lower costs and improve access for everyone. I will continue, as I have over the course of this session, to work on the language of this bill to make the proposals as strong as possible. And I want to acknowledge that there are those who feel this bill doesn't go far enough when we have the opportunity to make changes that will help many who are worthy of our attention. And I am committed to making changes to address concerns as we move forward. And Mr. Chair, I don't know if you want me to walk through the bill. I just got the engrossed version now today, but I can go through briefly that if you'd like.
Members, we have a quorum. Please proceed.
Thank you. Let me just get out the engrossment. Yeah, so the first article, Article 1, is facilitating enrollment. This includes a provision that has to do with, it's called easy enrollment. It will allow Minnesotans who wish to find out if they are eligible for financial assistance for their health insurance coverage by checking a box on their tax forms. This will allow connection from the Department of Revenue to MNsure to conduct this research and then to let them know if they will qualify for a Minnesota public program. Also included in this section is some language that, or this article that would make sure that when the Department of Human Services is letting people know that they need to update their information, that they will also use a very thorough process to make sure that they are contacting individuals multiple times so that they aren't disenrolled inadvertently. This article also includes that for children ages 6 years to under 21, they will be eligible for medical assistance for a continuous 12-month period, and children under 6 who is determined eligible for medical assistance, they will be determined to be eligible until the child reaches 6 years of age. Then in Article 1 also is the eligibility for children under 19 years of age who are undocumented non-citizens to have access to Minnesota Care, or eligibility for Minnesota Care. And let's see, those are, I think, high level the provisions in Article 1. Article 2 has to do with affordability. It would set up a healthcare affordability board. This would be established to help us better understand our total spending on healthcare in Minnesota, and also to create reports to look for ways to measure the impact of healthcare spending on our economy, and also are we getting the type of return on our investment. It would allow for setting up targets for healthcare cost growth and make recommendations for legislative policies to help lower the rate of growth in commercial healthcare costs and improve the quality and value of care for Minnesotans. This would be done through this board and a healthcare affordability advisory council. There's information in this article about setting the growth targets and how that would work with performance improvement plans being possible. And also reporting to be done on healthcare spending trends. And then when you get to Section 9 in Article 2, it talks about the state-funded cost-sharing reductions. This would provide for a cost-sharing reduction whereby an enrollee could sign up for a silver level plan, and it would be the actuarial value would be increased to 87%. And then there's also Section 11 has to do with the Healthcare Affordability Board. Again, an Office of Patient Protection would be set up. Article 3 goes into the public option and the process for getting that set up and the work that would need to be done to actually transition to a Minnesota Care public option. The requests for federal approval that's needed, the requests for reports that are needed to move forward with that. In Article 4, there's healthcare model studies, and this would include Section 1 is a analysis of benefits and costs of a universal healthcare system. This is a Senator Marty bill that we heard in my committee. And then Article 5 is the appropriations section. At a high level, I would just like to reiterate that the bill includes ways to address barriers to existing coverage options. It includes immediate cost relief with the state subsidy for Minnesotans enrolled in plans on MNsure to reduce their out-of-pocket costs. It includes transformational change having to do with the Healthcare Affordability Board, public program coverage for undocumented children and youth, and the Minnesota Care buy-in language. So I would be happy to answer questions about the bill, or if you want to move to testifiers, that would be fine.
Thank you, Senator Wiklund. I think we will move to testifiers. There are 8 testifiers registered. Could we please bring forward Mr. Jeremy Messersmith and Leota Goodney? Welcome to the committee. Please introduce yourself for the record and proceed.
Thank you, Mr. Chair and members of the committee. My name is Jeremy Messersmith. I'm a singer-songwriter from Senator Wiklund's district in Minneapolis. I sing songs about kittens, mostly. And I'm here to support Senate File 49. I've lived in Minnesota for over 20 years. It's my home and creative hub. I spent my early 20s slinging coffee during the day and playing open mics at night. For a few of those magical years, I qualified for Minnesota Care, which to this day is the best health insurance I've ever had, and why I support this bill. Making art is fun. Making a living making art is a challenge. As an artist, my income varies greatly from year to year. This makes budgeting for healthcare extremely difficult, especially if you're someone like me who has consistently used the healthcare system for chronic conditions or the occasional collapsed lung. For years, I've been enrolled in bronze-level plans paying over $11,000 a year in deductibles, premiums, and out-of-pocket costs. I've had countless conversations with fellow artists who have been forced to curtail or abandon their pursuits, not because of a lack of financial viability, but simply because they couldn't afford health care for themselves or their families. Artists, culture bearers, and creative business owners have valuable skills to help us build social connection, improve mental health, rethink and reimagine public spaces and institutions, and tackle our most pressing challenges. However, to fully benefit from the contributions that artists can make to Minnesota's economy, vibrancy, and future, artists need to be able to make a living and a life in Minnesota. Minnesota has a history of supporting the arts, and culturally, I think we box far above our weight class. Our ecosystem gave us Dylan, Prince, and Dessa. It's why artists like Nirvana and Lizzo have done creative work in our state. I'm grateful for my senator for carrying this bill, and urge lawmakers to pass a version that supports artists, farmers, small business owners, and essential workers across the state, including our neighbors without status. Thank you.
Thank you, Mr. Messersmith. And as you clear the table, could Rolando Juarez Orozco please come forward? Ms. Goodney, please introduce yourself for the record and proceed.
I'm Leota Goodney. I'm a retired CPA and small business owner in Northfield, and I'm a leader with Isaiah. Thank you to Senator Wiklund for carrying SF 49. I support this bill as another option for providing affordable health insurance for small businesses and for individuals who do not have access to employer-provided health insurance. Over the years, my business considered providing health insurance, but always found it too expensive. In at least one case, we lost a good employee because we did not offer health insurance. Many of our small business clients in rural Minnesota struggle to provide benefits that are comparable to those available to larger employers. Some business owners themselves go without health insurance. Others limit the size of their business so that they can qualify for the subsidies on the MNsure exchange. My personal family's insurance costs have been very high over the last 12 years since my husband retired from his corporate job. We are a family of 3, including my brother-in-law. Both my brother-in-law and my husband have chronic health problems. My husband and I are old enough to qualify for Medicare, but my brother-in-law is still on insurance obtained through MNsure. His premiums are $1,063 per month with a $6,000 deductible. Between his insurance, Medicare premiums, and out-of-pocket costs, our total medical costs in 2022 were over $33,000. Through experience with other family members, I know that MNcare is a comprehensive insurance program that does not include high deductibles. This bill will give small businesses and their employees access to high-quality health insurance program with a large risk pool. Please pass SF 49 and give small businesses, farmers, and individuals not working for large employers an affordable, high-quality health insurance option. Thank you.
Thank you, Ms. Goodney. Mr. Orozco. Welcome to the committee. Please introduce yourself and proceed.
Thank you. Chair Klein, committee members, my name is Sara Lopez, and I'm the policy director at Unidos Minnesota, and I'm going to be interpreting for Mr. Orozco. He's going to begin his testimony in Spanish.
Sí, mi nombre es Rolando Juárez Orozco. Soy un líder del Unidos. Vivo en South Bend, Minnesota. He estado viviendo en los Estados Unidos de 1990 por 32 años. He contribuido a esta economía, a este país, con mi trabajo. He pagado mis impuestos. Soy un trabajador esencial.
My name is Rolando Juarez Orozco, and I'm a leader with Unidos Minnesota. I live in Sauk Center, Minnesota, and I have been living in the United States since 1990, and for 32 years. I have been contributing to the economy of this country with my work and paying taxes. I am an essential worker.
Desafortunadamente, en el 2015 fui diagnosticado con un problema renal. Desde entonces he estado en diálisis 3 veces a la semana. He pasado alrededor de 18 horas en la hospital. Estos 7 años, los costos de mi médico están causando, ha sido difíciles que no tener un seguro médico.
Unfortunately, in 2015, I was diagnosed with kidney failure. Since then, I have been on dialysis 3 times a week, and I spend around 18 hours per week in the hospital. In these 7 years, the medical cost that this has caused has been difficult since I don't have health insurance.
El no tener un seguro de salud significa constantemente tener que elegir entre comprar las medicinas que necesito o pagar o recibir mis diálisis, cual es una decisión muy difícil de tomar, ya que en mi vida depende de ambas cosas. Además, las opciones para recibir algunos tipos de alimentos son limitadas, ya que los programas me envían a buscar comidas enlatadas o vencidas, las cuales no contribuyen a nada a la dieta que debería de llevar por mis condiciones de salud.
Not having health insurance means that I constantly have to choose between buying the medicines I need or paying to receive my dialysis, which is a very difficult decision to make since my life depends on both of those things. In addition, the options to receive some food are limited since programs send me looking for canned foods, which do not contribute at all to the diet that I should be having due to my condition. And this is the last part.
Las políticas no deberían de interferir en la salud, en la vida de las personas. Por lo tanto, es necesario que se apruebe la ley para que todos tengamos acceso a un seguro médico. Espero que mi testimonio sirva para impulsar que otras personas se beneficien. Gracias.
That is why I would like to end by saying that politics shall not interfere with people's health or lives. Therefore, it is necessary that this law is approved so that we all have access to health insurance. Thank you very much.
Thank you to both of you for your testimony. And as you clear the table, can Mr. Robert Hayter come forward and Ms. Ann Schwagerell? Mr. Hayter, welcome to the committee. Please introduce yourself for the record and proceed.
Thank you, Chair Klein, members of the committee. My name is Robert Hyder, and I'm the Legislative Director at Take Action Minnesota. We are a statewide multiracial people's organization with 15 years of experience working on state healthcare issues. I want to thank you for this opportunity today to speak in support of the MinCare public option. Since 2017, Minnesota has spent over $1 billion shoring up the failing health insurance market through reinsurance, propping up our current system that does nothing to expand coverage, lower deductibles, or rein in the cost of health care. At the same time, the federal government spends around $570 million per biennium subsidizing health insurance premiums in Minnesota. This legislative session is critical to establishing a plan to address the failing health insurance market before last year's 3-year reinsurance deal ends, and to begin the federal waiver process necessary to provide better quality and affordable health coverage to Minnesotans. Inaction is not an option. Lastly, we urge the Minnesota Senate to pass the House version of the proposal that includes adult immigrants without status. Everyone needs and deserves health coverage, and it is wrong to leave anyone out. Take Action has led policy work on this bill for 6 years. From closing coverage gaps with the Minnesota Care Family Glitch to the Immigrant Inclusion Act, they've always been critical within the public option proposal. This portion of the bill has broad support from advocacy groups as well as hospitals, health plans, and medical associations. If passed with the full immigrant inclusion, the MinCare public option will make Minnesota a healthier state that leaves no one behind. We urge you to support this bill. Thank you.
Thank you, Mr. Hayter. And as you clear the table, can Mr. Dan Andreessen come forward? Ms. Schwagerl, please introduce yourself and proceed.
Chair Klein, members of the committee. For the record, my name is Ann Schwegel, and I'm the Vice President of Minnesota Farmers Union. I'm honored to testify in support of Senate File 49, and specifically the provision to expand Minnesota Care with a public option that will allow farmers and others to buy into a successful and comprehensive state program. When our members met in November, they identified addressing healthcare costs as a top priority for this session. To quote one farmer, "If you're going to do one thing to make it easier to farm, it would be to figure out our healthcare." We believe strongly that this proposal is a meaningful step toward a future where no Minnesotan has to choose between farming, starting a small business, and getting the healthcare that they need. My family farms in Big Stone County in the western edge of the state, where I raise grain crops, a few livestock, and 2 young children with my husband. Much like other farmers, healthcare has been a persistent challenge for our family. For our first decade of farming, we had to do careful work every year with our accountant to limit our business so that we could still qualify for public programs. It wasn't a great feeling, but there was no way that we could afford insurance on the private market, particularly good coverage that we could use should an accident happen on our farm. Now that I have insurance through my employer, Farmers Union, I'm terrified to lose it. And that too is the experience of so many of our members who are tied to an off-farm job for healthcare coverage. As this proposal moves forward, we appreciate your consideration of expanding the public option to small businesses and including undocumented Minnesotans in Minnesota Care. Finally, when we think about the impact of this policy on greater Minnesota, we think about it as broader than individual families who are struggling to pay bills. The high cost of healthcare is a principal barrier for young people who want to farm, become entrepreneurs, move to a new region, or start a family. If we want an economy where everyone has opportunity, vibrant rural communities, thriving rural schools, and new families on the land, we need to figure out healthcare. And this is an important first step. I appreciate your consideration today, and I thank Senator Wiklund for her leadership on this proposal. We'd be happy to stand for any questions.
Well, thank you, Ms. Schwagerl. And as you clear the table, can Mr. Mike Anderson please come forward? Mr. Andreessen, welcome to the committee. Please introduce yourself and proceed.
Mr. Chair, members of the committee, my name is Dan Andreessen with the Minnesota Council of Health Plans. Appreciate the conversations we've had with Senator Wiklund on the bill thus far, and happy to continue those conversations as the bill goes forward. There are a couple provisions in the bill that the council does support. Article 1, the continuous MA eligibility for children, as well as expanding Minnesota Care eligibility for children who are undocumented. We also support provision in Article 2 regarding civil level cost-sharing reductions, but we do want to make sure that if those are enacted, that we reduce any kind of administrative challenges and that they're transparent to enrollees. Article 3 regarding the buy-in section, we do appreciate the language in there regarding the study that we're studying this proposal, as well as inclusion of contingent effective dates. We do feel like there's a couple provisions in there that we can accentuate. One would be further analysis on the commercial impact to this plan, to the commercial market, which is regarding market stability, adverse selection, and cost shifting to other markets. We'd also like further analysis of any coverage differences between commercial plans and Minnesota Care. We do see sometimes proposals being brought forward that will exempt public programs from those requirements, so we just want to make sure that if Minnesota Care is out on the insurance market, just like a commercial plan, that they're identical. We also do want to look at further impacts to provider reimbursement. I know that's part of the bill, but just want to really look into that further. We've heard this session from providers that reimbursement for state public programs is much less, and sometimes they don't see people who are enrolled in state public programs, which includes Minnesota Care, because of that reimbursement rate. So we're concerned that this could impact healthcare access as well as shift costs to the commercial market. And lastly, I don't think we should go into the process assuming that Minnesota Care buy-in is the only option out there. We'd advocate for studying other options such as state-level subsidies. We hear that folks are interested in getting into Minnesota Care because it's a lower out-of-pocket cost product. And that's because it's set by the state as a 94% actuarial value product, meaning that 94% is paid through premiums and 6% is through cost sharing. In terms of Minnesota Care, that 94% is mainly subsidized by the state. So if there's interest in moving folks into that product, there's already products on the market that are out there in, the gold level, higher level gold medal products. And we could just subsidize folks to get up in that level if that's an option. So I'd advocate studying that as well, but happy to keep the conversation going. Thank you.
Thank you, Mr. Andreessen. Mr. Anderson, please introduce yourself and proceed.
Mr. Chair, committee members, good afternoon. My name is Mike Anderson. I'm an independent insurance agent serving individuals and employer customers and clients throughout the state of Minnesota. I'm here today representing the Agents Coalition, which includes 4 professional agent associations in Minnesota. Collectively, we represent over 54,000 licensed insurance agents throughout Minnesota and their employees and clients. The Agents Coalition opposes SF 49, the Minnesota Care Public Buy-in, which creates an unfair government-sponsored competitor in our Minnesota private-based insurance plans. It's unfair for 4 reasons, and first, I think the most important. First, claims are the biggest part of insurance premiums. The most significant advantage of a public option is the fact that the government programs pay lower reimbursement rates to hospitals and clinics compared to the private health plans, rates that they previously agreed to provide health care to the working poor. A 2021 report from the Minnesota Community Measurement shows that commercial plans pay 207% of what Medicare pays. Minnesota Care actually pays providers less than Medicare, so the difference is even more stark. Secondly, unlike private insurers, the government has no capital requirement. Private insurers must charge rates high enough to keep them financially solvent. With a public option, the taxpayers will have to pay any shortfall. Third, private insurance carriers also pay the cost of compliance with numerous regulations with Minnesota Care does not have to comply. Finally, enrollees in a private health plan may pay a number of taxes that the state programs don't have to pay. The loss of these tax revenues should be accounted for in the cost of the program. These facts account for the price advantage that is being used to sell Minnesota Care as a cheaper alternative. Lower reimbursement rates will threaten the solvency of our community clinics and hospitals, as an even higher percentage of their patients are reimbursed with a low government rate instead of the higher commercial rates that makes our healthcare system work. When private plans cannot compete, my clients, your constituents, and my family will quickly find that the public option will soon be their only option, and they will not be happy with their lack of choice. We ask you to oppose this plan. Thank you for the opportunity to testify.
Thank you, Mr. Anderson. Are there other members of the public who were not signed up that would like to testify on this bill? Seeing none, we can go to member questions or comments. I'll begin. Senator Wiklund, can you tell me about the timing of the expiration of our current funding of the reinsurance program and then the startup time of this, and is there a gap there that we need to be thinking about? Or?
Mr. Chair, the timing for reinsurance, I believe we have 2 more years after this year for that. The structure of this program, or this, the Minnesota Care buy-in option would be that it would be in place or implemented starting the January of 2027. So I believe that we're covering 25 and 26 with reinsurance, let's see, 24 and 25. We believe that any time in between, which I'm not having, I don't have the information in front of me on the reinsurance, but we would be continuing the state subsidies for the cost sharing reductions. So that would be starting in 2024 plan year, that anyone between 201 and 250% of federal poverty level who enrolls in a silver plan, they would get a state subsidy that increases the value to a gold plan. And then starting in 2026, the program would be expanded to 251% to 300% of FPL, where their silver plan will become a silver plus plan. And then the subsidies would remain in effect until the buy-in can be implemented.
Thank you, Senator Wiklund. Yeah, that's my understanding too. And I think, I know you mentioned you're going to continue to work on this going forward. I don't think either of us thinks this is a finished product, but I think that's an area to be addressed, and sort of the interaction between our current reinsurance program and this as an option. Do we want them to continue arm in arm, or are we replacing the one with the other, and what do we do about that lapse in timing? So those will be questions I'll have going forward. Other members, questions or comments? Senator Rasmussen.
Thank you, Mr. Chair. Question for Senator Wiklund. Senator Wiklund, we had some testimony today talking about how this bill could potentially make health care more affordable. And I was wondering if you could explain to the committee where that cost savings is going to be coming from.
Mr. Chair, Senator Rasmussen, it would come from the fact that people would be able to get the cost-sharing subsidy to allow them to have access to a higher metal level plan, and that would reduce their costs, out-of-pocket costs. The cost-sharing is lower. So that's where they would see reduced costs, as well as it would subsidize the actual purchase of that plan. Is that getting at your question?
Thank you, Mr. Chair, and thank you, Senator Wiklund. So I guess I'm trying to understand, so would these be cost sharing that would be beyond what we could already do using a basic health plan, or other types of subsidies that are currently made through MNsure, both at the federal and the state level? I'm trying to figure out, is there any additional monies that would be coming in with this buy-in?
Mr. Chair, Senator Rasmussen, yes, there's additional subsidies coming in through this proposal. So that would bring down the out-of-pocket cost, because they would be able to have the actual higher actuarial value plan that they'd be accessing.
Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Senator Wiklund. And I guess that would kind of take me to a broader concern that the only way to take cost out of healthcare is to take cost out of healthcare. And we can look at different ways we can subsidize it and cost shift. But ultimately, at the end of the day, I don't think this bill solves the fundamental problem of trying to address the root cost problem that we have in healthcare and the increase in cost. In addition, Mr. Chair and members, I view this bill, and especially I would direct members to take a look at Article 4. This bill is clearly laying out the roadmap to single-payer health care here in the state of Minnesota. And I think that's just something that, as a committee, we have to think about long and hard. And when we look at other single-payer healthcare systems around the world, whether they be in the United Kingdom, whether they be in Canada, there are many pitfalls and shortcomings that come along with those plans. And we haven't seen a state successfully go down that path towards single-payer health care. I understand it's just a study when we look at Article 4, but I guess my two concerns with the bill are it doesn't really address the core issues of cost that Minnesotan families are facing while setting Minnesota up and signaling to the public, and especially to our healthcare providers and health insurers, that Minnesota intends to take a look seriously at a single-payer healthcare system.
Senator Wiklund.
Mr. Chair, Senator Rasmussen, I think that lowering costs in the healthcare system it should be one of our goals. I mean, that should be part of it. That may not be directly in this bill, although I would point you to that healthcare. This healthcare affordability board, by establishing that, we would develop a method of analyzing our costs, our healthcare costs in the system, and also possibly putting in place targets so that we could be, trying to reduce the rate of growth in healthcare costs. And then as far as the universal health care, I believe that it's hard for us to make a statement about whether universal health reform would work or not without having done a benefit and cost analysis. And that's why we feel that a comprehensive report or a comprehensive analysis is needed to be able to give us the information about how it could possibly be implemented, if it's possible to implement it, and what would be the impact on our current system.
I just want to add, thank you, Senator Wiklund, Senator Rasmussen. I just want to add on to those comments. I agree that the provisions regarding the Health Care Affordability Board speak directly to controlling healthcare costs, and they go hand in hand with the Prescription Drug Affordability Board, which we are going to pass off the floor from this committee on Friday. So I think there are cost containment measures that this caucus is pushing forward. In addition, the article of concern in Section 4 regarding a study of universal health care is just that, a study. It's not a signal that this caucus has a opinion about that one way or the other. Knowledge is power, as I've said in another committee, and other states that have tried to implement this have failed. We'd prefer to go in with open eyes and compare it to our existing coverage, so I'm appreciative of that provision in the bill. So, other member questions or comments? Senator Howe?
Thank you, Mr. Chair, and Senator Wiklund. You know, I think this committee's done a pretty good job of identifying coverage differences between Minnesota Care and the commercial market. You know, we've done the infertility benefit mandate to both the individual market and Minnesota Care, but then last week we carved out Minnesota Care out of the two mandates, the cozy caps and the white bagging. Can someone, because I got a feeling that people are going to have to make decisions on these choices, what benefits are here and what benefits are there. Is there a flow chart or can someone walk me through exactly what are all the differences between Minnesota Care and the commercial benefits? Or if that's too big of an ask, can we get that provided to us before we actually do final passage of the bill?
Mr. Chair, Senator Howe, I don't know that I can't give you that comparison in just a few words, but I'm sure that there would be a way to provide information about, what does Minnesota Care currently cover, and what makes up that current product. And then the individual market on MNsure, people can explore, what types of options are available on the individual market. I'm not sure if there's a summary that's easily available that would just say, here's what each of them looks like.
Thank you, Mr. Chair. And I guess what my concern is if we don't know here and can't look at it, how are the folks out there that are going to buy this product, how are they going to make that decision and actually do a decent comparison so they know it'd be a bad deal to decide to go one way and then all of a sudden what they thought was covered now isn't covered. So I think in order to do this right by the public that are going to buy these products, we should be able to have an easy access to be able to say, well, I need this coverage. Where is it in what plan? And if we don't provide something easy for them to look at, they may end up buying the wrong coverage and not having the coverage they needed.
Senator Wiklund, before you respond, I'm just going to add, because I think that is a relevant point, that the current sort of shopping market for healthcare plans in Minnesota is Byzantine. One of the provisions in our omnibus finance bill, which you were helpful passing off of this committee last week, was a provision for simplified healthcare plans through the Department of Commerce. So trying to look at the products available on the exchange and make it very transparent to Minnesotans and simplified what the costs are, what the co-payments are, and what the benefits are. And so I think that's an issue that we take seriously in this committee and in the Department of Commerce, and we'll work to address. Senator Wiklund.
And Mr. Chair, Senator Howe, I'll just add that that has to be part of any sort of implementation of the Minnesota Care, option would be having a clear place on the marketplace for people to explore what does it include versus other products that they could purchase. I do have information I can forward to the chair if you could distribute to the committee. There is a PDF that has all of the summary of coverage, cost sharing, and limits for Minnesota Care, and that might be helpful. Just you could see everything listed out in the current Minnesota Care, what's available.
Other member questions or comments? Seeing none. Closing comments, Senator Wiklund.
Well, thank you, Mr. Chair. Thank you for the questions. I hope that if others have more questions about the bill, I would be happy to answer them. I do think that this bill includes provisions that are, not only things that we can address in an immediate way to provide cost relief to Minnesotans. It will also allow us to gather the information that we need to implement a buy-in option, and it also positions us to be able to kind of transform our healthcare system through the Healthcare Affordability Board. So I appreciate the time today, and thank you for hearing the bill.
Well, thank you, Senator Wiklund. Senator Wiklund moves that Senate File 49 be recommended to pass and referred to the Committee on Finance. All in favor say aye. Aye.
Aye.
Opposed say no. Motion prevails. Senate File 49 is sent to the Finance Committee. Thank you, Senator Wiklund. Senator Fateh. We have 3 members here.
Say again?
You put the 810 in between us? The 810 in
Oh, yes,
so
I'm
two
sorry.
votes in order.
Yes, of course.
Thank you.
Thank you.
Members, Senate File 2319 is on the table. I am going to move that Senate File 2319 be taken from the table. All those in favor say aye. Aye. Opposed? Senate File 2319 is before the committee. Before we begin, thank you, Senator Fateh, for presenting this bill. Once again, today we have several testifiers. This committee has already heard testimony on this bill. I'm going to ask the testifiers, as I did last time, to not repeat the comments that you made on the previous visit. We are familiar with those. We will have an amendment, and I would be hopeful that most comments will be directed to that amendment. The sections that are relevant to our jurisdiction can be reviewed by council, but essentially they pertain exclusively to sort of the insurance and specifically the liability insurance provisions within the bill. And those, I also would ask the testifiers to confine their comments to those. Our plan for this bill will be to pass it to the Judiciary Committee from here. And so other issues can be addressed in other committees. And Mr. Hudala, can you review the areas of jurisdiction?
Mr. Chair?
Yeah.
Sorry, I think it has to go to Rules Committee next first. Is that correct?
Correct, yeah,
Okay.
yeah, yes, correct. Mr. Hudala.
Thank you, Mr. Chair, members of the committee. As Chair Klein mentioned, the jurisdiction of this committee really relates to liability insurance, auto insurance provisions in the bill. Specifically, those are encompassed in Section 2 of the bill, which is obligations and duties, insurance requirements, and then would also bring in Section 1, which relates to the definitions used in the bill. Thanks.
Senator Fateh, Senate File 2319.
Yes, thank you so much for bringing this bill back, Mr. Chair, members of the committee. I'll try to be brief as possible. I know I spoke a lot about the provisions within the bill. I think this one amendment just deals with the insurance requirements. Right now, there's nothing that Uber or Lyft has been doing to provide protections for the workers. Right now, we've heard stories about workers, if they've gotten stabbed, shot, hurt, Uber has done nothing. If they die, nothing happens. There's no process in place for deactivations, for example, as well. And why that's happening. So I'll let the testifiers, before I continue on, speak to those pieces as well, and I'll pass it over to Mr. Cooper, if possible, to expand on the 810.
Chair Klein.
Hang on, one moment. Mr. Cooper.
Thank you very much. This bill's gone through a lot of revision and improvement, largely with multiple meetings with Aaron Cocking, who is very knowledgeable on these issues. He's here today, and he says the bill is acceptable in all insurance respects. Let me go into a couple things that are not in the bill.
There's no reference to workers' compensation. There's no utilization of workers' compensation in any way. The bill does not require a particular type of insurance to be purchased. It leaves that up to the TNCs. First of all, the statute has always allowed for the TNCs to pay all of, half of, or none of, and the drivers to pay all of, half of, or none of the auto insurance. The TNCs have always taken advantage of that and made the drivers pay 100% of it. So when they tell you they have $1.5 million of coverage, that's all purchased by the drivers. What this does is it splits it evenly on the automobile insurance. It splits it evenly where they each pay their half. It also adds, and this is the most concernful thing, you heard the testimony before of people who had been seriously injured, didn't get a penny. It reminds me of that ad that you see on where it says, you exercise, you do this, and I forget which disease, shingles doesn't care. Well, in this particular case, we have the exact same thing. The TNCs don't care. No matter how badly injured you are, they don't pay a penny. They don't give you, are you feeling better phone call. They don't send you a card. They do nothing. So that means that the drivers who are injured wind up with absolutely no compensation at all, which either throws that on the taxpayers or it leaves them totally with no benefits. This bill addresses that. There's part one and part two. Part one is really talking about the automobile insurance. Part two is really talking about the catastrophic event insurance. Now, the catastrophic event insurance is very limited. It only covers those situations that manifest themselves within 10 days. So it does not cover things like carpal tunnel or other slowly developing issues. It covers being stabbed, it covers being shot, it covers being hit over the head with a lead pipe, it covers being beat up, it covers those kinds of things. The changes in here from the last time it was in front of you, I think are all very, very helpful, and I would think that this should be something that is streamlined enough to pass.
Well, thank you, Mr. Cooper. And before we go to other testifiers, I am going to myself offer the A10 amendment so that we can address the bill in its proper form.
Mr. Chair?
Senator Rasmussen.
Mr. Chair, if I guess I would prefer, and it's your prerogative, but I'd prefer that we wait to hear testimony, especially on the A10, before we take a vote on it.
That is absolutely fair. We'll go to testifiers. If I could have Mr. Aid Ali come forward and Abdullahi Abdi. Mr. Ali, please introduce yourself for the record and proceed.
Okay. Mr. Chair and the committee members, thank you so much for giving us this opportunity to testify here in front of you. My name is Eid Ali, and I'm the president of MOLDA. It's an organization that advocates the well-being of the drivers. I'm also a father of 5 lovely kids. I am the breadwinner of the family. And one thing I know is that this driving profession is not a free risk one. And every day that I step out of the door of my house, I worry about if I may be coming back safely home and spend some time with my young family. Because I know as the head of this organization, I met many drivers who were hurt, and some of them even lost their lives while they were driving for Uber and Lyft. In one of our earlier hearings, we had a female who was a mom of 5 and pregnant with her 6th child at the time, testified that her Uber driver spouse was shot to death while he was on his way to pick up a passenger. And no one from Uber since today did not even contact her to say, "We're sorry for the loss of your spouse." We also have so many other drivers today here sitting right behind me who would love to testify but may not get the opportunity to do that, who were also hurt and cannot function properly and cannot even earn for their own families. That is why, Mr. Chair, that we need bill to be passed to the next level because we are not asking a lot. We are asking at least to get the minimum protection for those drivers, including myself. Thank you so much, and you have a wonderful day.
Thank you, sir. And as you clear the table, could Mr. Abdirashid Salan come forward? Mr. Abdi, please introduce yourself for the record.
Translation.
I'm sorry?
He's going to translate.
Mr. Abdi, please proceed.
magacayga waa Cabdullaahi Cabdi.
My name is Abdullahi Abdi.
Waxaan u shaqeeyaa Uber iyo Lyft.
I drive for Uber and Lyft.
2021 bishii 8 baa dhaawacan aad aragtaan igu dhacayo dhiigga igu yaalo waa shaartigii dhibka igu gaaray.
2021, July 2021, this T-shirt, this shirt that I'm wearing is what I was wearing at the time when I get that incident.
markaati shaarkaas aadin oo inaan si hadda arrintaas inaan hadda si galgala mar markii inta dhibkaas igu dhacay Uber igama ayna soo daba xiriirin.
I don't have to go into details because of this is a good display for what has happened at the time, and Uber has never contacted me ever since.
Ramsey County oo dhaawac igu gaarana ninkii way soo qabteen waa la xiray waana la sii daayay.
And the Ramsey County where I was injured had the guy in their custody and later on released.
Intaasi markay dhacday anigu dhibka i gaaray waxaan aaday lawyer baan raadsaday.
When that happened, I went to just get an attorney.
Lawyerkii wuxuu ii sheegay in aanan Uber waxba kaagama qaban karo igu yiri.
And the attorney told me that he wasn't able to do anything about his case with Uber.
Sababtana waa kuu sheegayaa buu yiri.
And he said, I'm going to tell you the reason.
Uber wuxuu yiri jeebka ayay gashadeen sharciga wadanka jeebkooda intay qaan jeebka gashadeen.
And he said that the law of the land was put into Uber's pocket.
warqad cad bay la soo baxeen oo soo qaateen oo ku qorteen wax allaale wixii dhibaato adiga xuquuqdaada ku diidi lahaa.
They got a blank paper which they wrote everything that was in their favor and was against your rights.
sharcigaas oo aan wax la fiiriyay iyo wax xuquuq oo la eegay iyo wax la community on la fiirin la ogaatay xuquuq aanan jirin.
And that written policy or law was not one that had a check and balance at the time.
marka sidaas aan waxba kaaga qaban karin Uber sharciga wadanka jeebkooda ku jira ilaa jeebkooda laga soo saaro sharciga waxba kama qaban karno ugu yeeray lawyerkii.
And the attorney said that's why I cannot do anything about your case because of this is something that is already in Uber's pocket and there's nothing I can do for you.
maanta meesha waxaan u soo fariistay aniga in sharciga wadanka jeebka Uber ku jira inta laga soo bixiyo xuquuqdana laga siiyo aad baan u mahadsantiin.
The reason why I'm today is to get that policy or law from Uber's pocket and for that reason to get my rights today. So thank you.
Thank you, Mr. Abdi. Next up, I think, is Abdirashid Salan, and if Joel Carlson could come to the table. Mr. Salan, please introduce yourself and proceed.
magacaygu waa Cabdirashiid Salaan.
My name is Abdirashiid Salam.
waxaan ahay darawalada Uber iyo Lyft u shaqeeya kamid ah.
I am one of those drivers who drive for Uber and Lyft.
waxaan rabaa inaan meeshan ka cadeeyo Uber anoo u shaqeynayo dhib isoo gaaray.
I just want to testify here a problem that I had while I was driving for Uber.
qof passenger waxaan ka qaaday airportka marka dhankaas register aan u sii waday qofka anoo wada ayaan shil galay.
I picked up someone from the airport and I was on my way to register, and then on the way to the register I ended up getting in an accident.
shilka markuu dhacay aniga xasuusti way iga tagtay waa la soo qaaday hospital baa la keenay 6 saacadood baan miir la'aan ahay.
When that happened, I was transported to the hospital and I was unconscious for 5 hours.
6 saacadood kadib ayaa nafti ugu soo noqotay. Uber wax uu ii qabtay ma jirto caafimaadka hataa wuu ii diiday.
And I went back to become conscious after 6 hours, and Uber didn't even cover my medical bills, and I got nothing.
gaarigayga wuu burburay 2,500 oo deductible baa iga jirteen laba bilood oon fadhiyana biilkii ima ay siinin.
And my car was total loss, and they told me that there is a deduction of $2,500 for their policy. And I also stayed 2 months at my house because of I wasn't feeling well, and for those 2 months I wasn't even compensated.
maskaxda waxay iga soo gaartay ilaa had saacadan wax baan dareemayaa hubur markaan la hadlay waxba way ii qaban waayeen ilaa saacadan wax ii qabtay ma jirto. Lawyer markaan u tagana wuxuu dhahay hubur iyo lefti sharci bay sameysteen oo dadka u shaqeeyo shaqaalaha u ah xuquuqda u diido, marka sidaas aan aniga waxba kugu qaban karin.
And as a result of that, I also get a brain damage, which I am not quite well doing what I used to do. And when I went to see an attorney, the attorney told me that there's nothing he can do with his situation because of Uber just kind of set up a system where you cannot get your rights.
Marka maanta waxaan u baahanahay marka cadaalad inaan helo oo guddigan community-ga ee waddanka xukumo inaan macnaha cadaalad ay sameysaan oo hubur macnaha xuquuqda aan leeyahay macnaha liiga soo.
And I'm here today testifying right in front of you to just kind of fight for my rights and to get my rights of the loss that I went through from Uber.
Thank you so much for testifying before the committee. Can I have Mr. Joel Carlson and Awil Shire please come to the table? Welcome to the committee, Mr. Carlson. Please introduce yourself and proceed.
Good afternoon, Mr. Chairman. Joel Carlson. I'm here on behalf of Uber Technologies, and just strongly disagree with some of the representations made here today, but that is not to minimize that violence happens to drivers and in our society, and we feel badly every single time that happens. So we're not minimizing that at all. But the suggestion and the continued idea that Uber does not provide insurance as required by Minnesota Statute 65B is just patently wrong. It's false. We provide that insurance. The drivers don't pay for that insurance. It's true, riders pay for it as part of their fare. But to suggest that Uber is not providing its insurance obligations as required by statute, as I've heard dozens of times, is just wrong. I'll speak, Mr. Chairman and members, to the A10 amendment. And as you move this bill to the Judiciary Committee and talk about some of these substantive rights, we're happy to engage in that conversation. But to the amendment itself, Uber has offered to the driver community to provide occupational accident insurance. That is not quite what is before you in Section 2, lines 1.5 through 1.25. But you're getting close. And that is a concept that we want to provide and have offered to provide to drivers. And so that portion of the amendment, I think, is something that we can work with as this moves forward. The second part of that, page 1.26 to 1.30, actually places a burden on the driver to pay for half of the insurance, which is not the case today. The insurance law right now, 65B 474, requires Uber to be primary coverage when they're engaged in their work. That is our obligation, and we meet that obligation, and I take some umbrage to the suggestion that we don't. But we don't charge the driver half of that insurance. They have to carry their own insurance on their cars like all of you. We all have to do that. But they don't pay for their insurance when they're engaged on the network, and the law doesn't allow that to happen. Uber's insurance is primary. So that provision on 1.26 through 1.30 is a new obligation on the driver to pay 50% of the insurance, and we think that's wrong, and we think that should be stricken from this amendment. The other things, Mr. Chairman, that we can work through in judiciary, independent contractor status, and how these employees are treated, I think are important conversations. So as this moves along, we're happy to work with the proponents of this bill, and we're a proponent of doing something as well. We're not quite there yet, but this striking some of the things that were in the bill are a step in the right direction. It still has the highest rates in the country. It still is not a viable vehicle for us to adopt as is, but we're willing to continue to work on it. Thank you, Mr. Chairman.
Thank you, Mr. Carlson. And for the committee's knowledge, the section of concern raised by Mr. Carlson, 1.26 to 1.30, when I do offer the 810, I plan to make an oral amendment to remove that section. Could we, if Mr. Awil Shire is present, or Mr. Abdullahi Ahmed? Senator Fateh.
Yeah, thank you. Really quick. Just a quick correction. It wouldn't be 1.26 to 1.30. I think it would be 1.26 until the period on 1.29 after clause 1.
Yeah, well, I'll get it exactly
No
right,
worries.
I promise,
No
once we
worries.
do the oral amendment, but
Thank
you're
you.
correct, yeah.
Thank you.
I'm not seeing the two listed testifiers, either Mr. Shire or Mr. Ahmed. Is Mr. Andrew Carlson and Mr. Weli Abdi here? Mr. Carlson, please introduce yourself for the record and proceed.
Good afternoon, Mr. Chair and members of the Senate Commerce Committee. My name is Andrew Carlson with Larkin Hoffman, here today testifying on behalf of Lyft. Again, just would want to start by saying we concur with a lot of the testimony made by Mr. Joel Carlson on behalf of Uber. In terms of new testimony, I will say that, and just to get it on the record here, that both Uber and Lyft now and always have paid 100% of the insurance coverage mandated by statute. This is not passed through the drivers or deducted from their earnings. We simply pay it. So we're grateful for the oral amendment that will be offered, because the way the bill is currently drafted, as we just discussed, would require 50% of that to be paid by the drivers. Just some concluding comments. This bill was first introduced on March 1st. Lyft has met with legislators and drivers and even shared draft language for their consideration, yet we have not received any feedback regarding our suggestions. Rather than passing a bill that will hurt drivers and riders, we welcome the opportunity to work together to create smart benefits that protect this important transportation option and earnings opportunity, combined with protecting the independence and flexibility that drivers in Minnesota overwhelmingly support. So we look forward to continuing this conversation at its next committee stop. Thank you.
Thank you, Mr. Carlson. And can I ask Mr. Aaron Cocking to come forward? Mr. Cocking, thank you for coming forward. Your name was raised by a previous testifier, signaling that you support the current version of the bill and the amendment as drafted. And I wanted to give you an opportunity to speak for yourself and introduce yourself and give any commentary you have for the committee.
Yeah, Mr. Chairman, members of the committee, Aaron Cocking with the Insurance Federation of Minnesota. As Mr. Cooper alluded to, we've had a number of conversations since this bill was last up and tabled in this committee a few weeks back. Most of our concerns at that time centered around the notion of workers' compensation and trying to drop some sort of requirement in this bill into Minnesota's very complicated work comp system. And all reference to work comp has been removed from this bill, as you see in Section 2, kind of getting at this and trying to create this in a different manner, which from our standpoint is better than kind of the reference to work comp. And so, yes, as this is currently written, we don't have any objections.
Thank you, Mr. Cocking.
Chair?
Senator Howell.
Can I ask
Yes.
a follow-up question? From my understanding, and I must not have been here when we heard this bill, but these drivers are all independent contractors, are they not? If someone could clarify that for me.
Either Mr. Cocking or the author.
You're asking the, Mr.
Yes.
Chair, Senator Howe, you're asking the wrong. I will defer
Yes.
to one of these guys. I would reiterate.
The reason I asked that, Mr. Cocking, is I've got a follow-up question once I determine what that, the status of them are.
Mr. Cooper, maybe, yeah.
Mr. Chair and Senator, the position that Uber and Lyft take is that they're independent contractors. That position has prevailed in some states and failed in other states. It's an issue that we are not addressing in this legislation because it is so fraught with its own battles.
Senator Howe.
Thank you, Mr. Chair. And I guess my question was, if they are considered in this realm independent contractors, I guess they could purchase, if they wanted to, their own workers' compensation insurance policy, could they not?
Mr. Cooper or Mr. Cocking.
Mr. Chair, Senator Howe, yes, Minnesota statute, Chapter 176 does allow or gives authorization for an independent contractor to buy workers' compensation insurance. That being said, the market for that, at least from the carriers that I represent, seems to be limited, if not existent. I know Mr. Cooper will tell you that he's been able to locate it via Google search or something else. I'm not familiar with, like I said, any of our carriers offering that, but the current Minnesota statute does allow for that to happen if a carrier wanted to offer it.
Senator Howe.
Well, thank you, Mr. Chair. And I know it exists. I had it at one time. For this, I did not have it. You know, being an independent contractor myself, I know that I've got my own insurance liabilities that I have to carry, and I wish I would have kept my policy up, but I did not. So that is the crux of the deal. But I just wanted to make sure, I'm just trying to get a clarification of exactly what we're dealing with here, so I got a clear picture as we go forward.
Yeah, and I'll just comment, Senator Howe, I think that is a very difficult question. I appreciate the testifiers adding value to that. It is also not within the jurisdiction of this committee. So if we do end up wrestling with the question of independent contractor status, I would defer that to the wisdom of the Labor Committee. But did you have a further comment, Mr. Cuggy?
No.
You know, before we go to member comments, I think I will go ahead and offer the amendment and get it corrected. Thank you, testifiers. So Senator Klein moves the A10 amendment, and Mr. Hodala, can you describe the oral amendment?
Thank you, Mr. Chair, members of the committee. The A10 amendment is amended as follows. Page 1, line 26, delete everything after the letter D. Page 1, delete lines 27 and 28. Page 1, line 29, delete everything before a driver. And page 1, line 30, delete everything after paragraph A and insert a period.
Members, do you understand the oral amendment? Any questions about the oral amendment? Okay, so we will move the A10 as orally amended. Are there questions or comments on the A10 as amended? Okay, seeing none, all in favor say aye. Aye. Opposed? Amendment is adopted. Member questions or comments? Senator Rasmussen.
Thank you, Mr. Chair. One question I'd have for you, Mr. Chair, or maybe for council is, will this bill be going to the tax committee at some point?
I will defer to council. I had not anticipated that is my answer.
Thank you, Mr. Chair. And the reason I bring that up is if we look, and I'm working off of the first engrossment here, page 8, starting at line 20. I basically read this, 25 cents from each trip that has to be remitted to this special revenue fund within the state treasury. It's basically a tax. And so I just want to make sure that this bill will be going to the tax committee because it has a new tax in here for Minnesotans.
Mr. Chair.
Mr. Cooper.
On the delete amendment you just read, that portion's been deleted. That entire section's been deleted. Additionally, as it originally was phrased, it was a pass-through. It did not come out of the revenues of Lyft. It was something a rider paid. But it's not before you anymore. It's been deleted as part of the thing you just passed.
Just one moment. I'm just pausing to confirm that's in the deleted.
It says delete section 14, and section 14 is the thing with the 19, or 20, I forget what it is, 25 cents, whatever it is. And that whole section has been deleted.
Yeah, that's been deleted in the 810.
That's accurate. The section has been deleted in the 810. Follow-up questions, Senator Rasmussen?
Thank you, Mr. Chair. I have a few concerns with this bill, and I think if we look at the 810 amendment that was adopted, and we look at the last language on here, talking about the dispute over the independent contractor status, I think that question still hasn't been answered. And the fundamental question we have here is, with this bill, basically we have individuals who want to have the flexibility of being an independent contractor while wanting the benefits of an employee. And that's why we see this notwithstanding language here in the bill. I believe that this was one of the reasons that the bill was tabled initially. I still don't think it's been fixed. And I just also worry, Mr. Chair, that this bill is going to make ride-sharing services more expensive for Minnesotans. And I worry that this will make ride-sharing a service that only higher-income Minnesotans can afford. And a lot of individuals, especially the elderly, the disabled, can use ride-sharing to get to appointments, to get to the doctor. Individuals who can't afford to have their own motor vehicle will use this service to get to work or to get to other activities. And this is going to increase the cost of ride-sharing to Minnesotans. I think that's very clear. And so just would ask committee members to vote no on the bill here today. And I think there's still more work that needs to be done. Thank you, Mr. Chair.
Thank you, Senator Rasmussen. I'll let the author respond if he wants. And I also want to just comment that with regards to those thorny issues about independent contractor status, I also agree that those need to be resolved before this bill goes to passage. With regards to your question about costs, I think that also is a significant question to be answered. But unfortunately, fortunately, the limit of our purview, I think, today are these insurance provisions, and we've heard from the insurance industry that they're acceptable. We've heard from Uber that they're acceptable. So I think the work of this committee can be completed with a green vote to move this forward, and some of those more difficult issues can be attacked in the appropriate committees. Any further comment from the author or Mr. Cooper?
Well, I guess I would just say that notwithstanding any other provisions, you're correct, is not for this group, but it is the language that's been used in other states successfully. But it's not in front of you, so I'll be quiet.
Senator Frantz.
Thank you very much, Mr. Chair. Senator Fateh, nice to see you again. I'm of the same mind as you, Mr. Chair, which is that we've got an obvious independent contractor issue. I raised it for you the first time. I raised it here again. I consider it totally unresolved. However, I think we should pass this out of committee and send it to judiciary. And before we do that, Mr. Chair, I just want to flag that I also just mentioned, took the thunder away from me, is the cost issue. I think Minnesotans will want to see drivers treated with respect and protected. I think that you have correctly. But I think Minnesotans will also say, is there an impact on the cost? And if so, what is it? And since you've got an insurance provision here that I think is in the province of the Commerce Committee, and since I'm hearing from all the stakeholders that they're ready to move this ahead, I would just say I consider the drivers to be a stakeholder. I consider Uber and Lyft to be stakeholders. Love the Insurance Federation. They are a participant. I don't know if they're a stakeholder. And with that, Mr. Chair, I'm going to be a yes vote on moving this thing to judiciary. Thank you.
Further questions or comments from the committee? Senator Fateh, closing comments.
Yeah, thank you so much for bringing the bill back, Mr. Chair and members of the committee. I want to say thank you to all the drivers and folks that showed up today. And I want to say a special thank you to Mr. Aaron Cocking, who's worked a lot with Mr. Cooper to make the language right. I know they've met several times and spoke over the phone a lot, so I appreciate their hard work in making this happen. So thank you all.
Thank you, Senator. The motion is from Senator Frantz that Senate File 2319 as amended be recommended to pass and refer to the Committee on Judiciary and Public Safety. All in favor say aye. Aye. Opposed say no. The motion prevails. Senate File 2319 as amended is passed. Members, we're adjourned.